The reach of this bill stretches deep into the ability of doctors to provide care to patients across this country through a $3 billion cut in health care to Americans served by doctor-owned hospitals. This is the second time in 7 months that the House will vote on legislation that seeks to ban doctor-owned hospitals by cutting funding from Medicare and Medicaid to these facilities. And as such, Mr. Speaker, it poses a very real and serious threat to some Americans' ability to access health care. One of the hospitals threatened by this proposal is the Wenatchee Valley Medical Center in my district in central Washington. The Wenatchee Valley Medical Center, Mr. Speaker, was founded in 1940 by 3 physicians. In the last 68 years, it has grown and now employs 1,500 people. It serves a population of 250,000 people in an area the size of the state of Maryland, and it treats 150,000 patients a year. It has been designated by the state of Washington as a critical need hospital that's serving a rural, underserved area. Today, Mr. Speaker, it is 100% owned by 150 doctors. Apparently, that is a crime, because this bill would outlaw this facility as it's existed for 68 years, because this bill would prohibit any hospital from being more than 40% owned by doctors if they are to continue receiving Medicare payments for the care that they provide to their seniors. Mr. Speaker, the Wenatchee Valley Medical Center has been treating and caring for patients longer than there has been even 50 states in our union, and yet this bill could end that care. When I discussed this threat to Wenatchee with their proposal sponsors last night in the Rules Committee, they said the simple answer was to sell the 60% stake in a government-ordered fire sale so that meets the 40% limit on doctor ownership. Not only is a fair price, Mr. Speaker, unlikely to be paid when selling under the threat of government action, but it is unfair and disruptive to any institution with a long record of excellent care. And Mr. Speaker, what is so nefarious about 100% doctor ownership, or 75%, or 50%, or even, Mr. Speaker, 41%? What is magically solved with the ownership of 40%? The answer is nothing. Nothing when it comes to Wenatchee. The irony is not lost on me that this bill only bans doctor-owned hospitals in an effort to supposedly target bad behavior. Consider this, Mr. Speaker. If a corporation engages in the exact same practices that this bill tries to stop doctor-owned hospitals from doing, the corporation would pay no penalty. It wouldn't even be touched. So apparently, patients are safer if corporations are in charge, but patients are in danger and taxpayers are being ripped off if doctors prosper from owning a hospital and are providing excellent care. What is really happening in this bill is a push to move our country ever closer to a Canadian-style, government-run health care system. As under this bill, such a Canadian-style system will replace good, high-quality care from down-home doctors with an extensive expertise, medical expertise, with an extensive medical expertise of Congress. The federal government would decide where Americans will get care and what hospitals will be banned or shut down. The federal government will also decide when Americans are allowed to get care, if they are allowed to get care at all. If the federal government can ban doctors from owning a hospital, then the health care access of every American, Mr. Speaker, in my view, is at risk. I fundamentally disagree with those who believe that an all-knowing Congress and thousands of federal bureaucrats can deliver Americans the best health care possible. Keep in mind, this ban on doctor-owned hospitals, quote unquote, saves $3 billion. Ironically, Mr. Speaker, this is accomplished by denying or reducing access to care for seniors and poor Americans on Medicaid and Medicare. Instead of growing the size and power of the federal government by taking decisions away from local doctors and removing freedoms from individual Americans, we should be allowing American patients to make more choices and free doctors to focus on their profession of healing. Mr. Speaker, when it comes to Wenatchee Valley Medical Center, the accusations of negligent care and fiscal rip-offs that are leveled at doctor-owned hospitals simply don't apply to this facility. Wenatchee is not guilty of the sins of others simply because it's a doctor-owned hospital since 1940. It should not be targeted or threatened for the real or anecdotal failures of recently created doctor-owned hospitals. The language in this bill is simply not ready for passage as it's currently written. It is too broad and imprecise. It would punish honest, well-performing hospitals and doctors and their patients for the actions of others. If there is bad behavior, Mr. Speaker, to be banned, then target that behavior. Don't impose an overreaching ban that harms innocent patients and doctors. My constituents are not alone in facing this threat. Both Mr. Hinojosa of Texas and Mr. Kagan of Wisconsin have similar concerns about health care institutions in their districts. Efforts to improve this legislation so that it doesn't threaten and harm our homegrown hospitals have not been met with openness. In fact, we've been denied on a bipartisan basis. Last night, in the Rules Committee, I made 3 separate attempts to try to offer an amendment to protect innocent hospitals. However, Democrats on the Rules Committee chose to deny each and every attempt to preserve the structure of my hospital and the hospitals of Mr. Hinojosa and Mr. Kagan. Mr. Speaker, there are legitimate bipartisan concerns about the toll this language would have on local hospitals that have done no harm and who provide important health care access to thousands of Americans. This bill needs to be corrected, not forced through the House with zero opportunity for improvement or amendment. This record-setting closed rule denies any chance for help to be provided to Wenatchee Valley Medical Center or to patients in hospitals in Texas and Wisconsin. The rule deserves to be defeated and this House allowed to vote on correcting this flawed bill. And with that, Mr. Speaker, I reserve the balance of my time.